Hey everybody, Dr. Wenzel, Brentwood MD. This is video 2 of a 3-part video series where we're doing a talk around reframing of the annual physical exam. On one end of the spectrum, you have your standard typical annual physical, and on the other end of the spectrum, you have more of an executive level exam. And in the last video, we talked about how the standard exam is really designed for speed and volume. It is based primarily on population-based recommendations and tends to be a reasonable approach for many people, especially in the younger, healthier crowds. And the executive level physical really is quite different in the sense that it is not optimized for speed and volume, but rather optimized for the individual and for results, and tends to be much more strategic. I also talked a little bit about how to identify your main health goals, how to identify the right provider, and how to come up with the right prioritization of the goals that you have. And if you haven't checked out that video, please go back. I think you'll find it interesting. The feedback I've been getting has really been great. In this video, I want to take it the next step, and I'm going to be giving you the 7-step approach in the exam to make it the most meaningful exam that is possible. And I think we have to answer some fundamental questions before we dive into this. And at least for me, when I am asked, hey, Aaron, why do you exist? Why does your practice exist? And I say, my desire is that people live a long time and they feel great. And I really feel like at some level, most physicians, that is their North Star. They really got into medicine because they wanted to make a meaningful difference in the lives of other people, and that's really their calling. And from a primary care standpoint, at least from where I'm sitting, if my primary goal as a primary care physician isn't to eliminate the top killers of human beings, or at least reduce your risk for running right towards the top killers of human beings, then I'm not sure what my purpose is. And I thought it would be interesting to start this discussion with looking at the top killers of all humans in 2008 in the United States. We've got heart attacks, cancer, accidents, COPD, strokes, Alzheimer's, diabetes, flu and pneumonia, kidney disease, and suicide. Collectively, and these are in order of greatest to least, nearly 80% of everything that takes a human off the earth is represented in these 10 things. So as they say, major and major things. I don't know a lot about some of the things that are less impactful, but what I'm really obsessed with are the things that lead people to one of these things. And frankly, there's no shortage of things that you could focus on. And if you're anything like me, or you're anything like many of my other private clients, the journey to becoming the healthiest version of you can be overwhelming at times. Where do you focus your attention? It seems like everywhere I look, one minute something's good, one minute something bad, one minute this is the most important thing, the next minute it doesn't matter. We are all overwhelmed with information and we seem to be lacking in wisdom and insight. So my hope in this video is simply to shed some insight on the things that I believe to be the most impactful things for your health. We start very quickly with number 1. Anybody who's spent any time with me, probably more than 10 minutes, you've heard me talk about the Holy Grail of health. And the Holy Grail of health, according to Dr. Wenzel, is an optimized blood sugar. To me, the gateway physiologic phenomena that leads to virtually every one of these except maybe accidents and potentially a lung infection and suicide. So 70% of these top killers is a normalized blood sugar. By definition, diabetes is the inability to control your blood sugar in a normal homeostasis setting. And as we begin to trend upwards with our blood sugars, we begin to get closer to this disease we call diabetes. And no disease will outpace diabetes in the next 20 years worldwide. It's stunning to think about Diabetes right now, currently, best we have data on, is number 7 on the top 10 killers of humans. And I suspect that's climbing. Not only does it stand alone, but it feeds a lot of these other things. 25% of the US population is diabetic. Another 25% of the US population is likely diabetic and not diagnosed yet. And then another 25% of the US adult population has probably got insulin resistance and metabolic syndrome. This is the number one thing to get our head around if we have ambition to feel great, minimize or delay chronic disease, and live a long time. Our number one goal each and every year, and with every time we sit down to look at our overall health every year in our exam, is where am I at on the spectrum of optimized blood sugar? Number 2, you've got to hunt for other metabolic diseases. These metabolic diseases would be indicators that your overall physiology and biochemistry is beginning to be suboptimal at best and potentially early disease state at worst. Primarily, these metabolic diseases, as I mentioned with the Holy Grail, are all due to insulin resistance or a pre-diabetic type situation that feed metabolic syndrome. We've got diabetes, hypertension, truncal obesity, a fatty liver, and dyslipidemia. Dyslipidemia are abnormal lipids, primarily a suppressed HDL and a very high triglyceride. I've created other content on this, the importance of looking at the triglyceride to HDL ratio, wanting to keep that in an optimal range as an indicator of more metabolic optimization. Number 3, once we have number 1 and number 2, we move to number 3, risk stratification. When we look at risk stratifying, we don't look at this at any different than we would financially or relationally or business opportunities. We've got modifiable, in other words, things that we can change or alter or influence, and we've got non-modifiable risk factors, things that we cannot change. I cannot change that I'm a man or that I'm 46 or that I have a family history of whatever my family history is. These are non-modifiable. Modifiable would be, do I smoke? Do I have 40 pounds of excess visceral fat on my body? Do I have diabetes? Am I engaging in risky behavior that otherwise would put my life in jeopardy? These are all modifiable risk factors. But specifically, in these 4 categories, we need to risk stratify in order to have maximum impact in our journey and to make sure that we are getting the most out of our annual physical. Heart disease, clearly, goes without explaining. It is the number 1 killer of human beings. Cancer, both age-appropriate cancer, so in younger men, we start thinking about prostate and colon cancer. As we get a little bit older, we might start thinking about other forms of cancers. Lung disease, whether that's COPD or if you have asthma, what is our situation on our immunizations? Are we flu and pneumonia vaccinated? Psychological, this is one of the most underrated topics in primary care. I'll be making a lot of content about this in the future. But this whole idea of work-life balance, stress management versus stress elimination, I don't know anybody who is a high-level individual who actually believes they can eliminate stress. Stress is a part of the human condition, but people who continue to move through life at high levels and at newer and higher levels don't eliminate stress. They're just better at managing stress. So these are some modifiable versus non-modifiable risk factors. We need to get some clarity on where our risk factors are for these 4 subcategories, because you can see outside of car accidents, that's everything else. Even suicide is in the top 10. We're really touching on the top 10. This is a very powerful strategy. Number 4, we need to aggressively treat the modifiable risk factors. That means anything that you can change, influence, do, you need to go all in on it. If it means pulling back on your alcohol intake, if it means finally hiring a trainer to get your butt into the gym to get some strength training so that you don't get hurt, if it means getting really serious about your diet so you can eliminate some visceral fat, if it means fixing your marriage, if it means finding a career that you're passionate about, whatever's modifiable, we need to modify it. And then we need to move to number 5, which is actively manage all non-modifiable. This means family history. There's nothing you can do if you had a mother at 52 who had breast cancer. However, you better have front of mind 10 years earlier than when she was diagnosed. You should be getting a mammogram, even if It doesn't fall within population-based recommendations. Number 6, as with everything in life, you cannot measure, you cannot manage what you do not measure. You need to measure, 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 measure. What are the objective outcomes? And then we need to adjust our strategy. There are no failures and no successes. There are just results. What you will do will either improve or not improve your risk stratification. And if the whole name of the game is to risk stratify in a way to put you at the least amount of risk for these 10 killers and to give you the best quality of life in the meantime, this is what we've got to do. Listen, I hope these 7 steps will be valuable for you. I know that these are really at the core of what I do with my private clients. This is in my thought process every single time we get together. And the name of the game is that we don't have to fix everything, because everything can't be important. If everything's important, that means nothing's important. I think I have a very clear picture on where I want people to go and a way that we want to get there. And I think this should be very valuable for you as you go into your primary care situation and really get some clarity on the things that are most important in making a big difference. In the next video, which will be the last video of this 3-part series, I hope to kind of unpack some really tactical level strategies in order to walk out some of these risk stratifying opportunities. And I think you'll find that really valuable. Until we meet again, take care, guys.